Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. With me, as always, Adam Thacker, who's our Chief Operating Officer and also pharmacist, so he'll be answering all the difficult medication questions this week. We're here to give you an update on what our past numbers have been, where we are now, and kind of what we see happening over the course of the next few months or so. Most importantly, we always talk about numbers, so it's leading off about 3,700 cases from the beginning, but most interesting numbers are always what the cases are as far as active in the community is around 30 as of this last Friday. And then looking at the positivity rates. The positivity rates have been coming down over the past few weeks or so, a little bit over 3% for all individuals, and then for unique individuals, just over 10%. And our county has moved into the blue, which is wonderful. We've seen that kind of fluctuate up and down over the course of the past month or so. But as those numbers have dropped, we feel a little bit better that those trends continue to come down and hopefully stay down. The number of active cases, though, has remained pretty much the same for the last few weeks or so. So we're still a little hesitant to slap high fives and feel fantastic about stuff because we can still have some community transmission going on. But definitely overall, things looking better.
Right. And if you see that our county color coding, we've turned blue, but the advisory is still yellow because we're in that period of time where we've made that shift to blue. But there's that 2-week period of time where we're still advisory of yellow. Now, given as we've went through this for a long period of time, blue to yellow and back and forth, we're not really seeing, there's not big fundamental changes in the community or events or that type of thing. But it does keep us aware that we're right on the cusp of that. And with there being that 10% transmission, that's still high enough that there is some transmission, and that easily could then become higher and higher. And we've seen that happen, not just in our county, but in surrounding counties as well. So important that we're still diligent about our hand hygiene. If anyone's sick, staying home from work or staying away from events. Most events are still looking at outdoor where possible. Capacity limits are somewhat being put into place, not necessarily a rule, if you will, for the community, but most of those leaders that are putting together events are looking at how do we do that in a socially distanced fashion that still allows everybody to have a good time but feel safe.
Yeah, and I think one of the important things from a clinical standpoint that we have seen is we've certainly seen positive cases over the past few weeks or so. And the most interesting thing about those are usually people are kind of oblivious to the fact that they have COVID because they feel like everything has sort of gone away. And so when they develop what we would consider to be fairly typical symptoms, they kind of wait that out for a few days. Right. And we really hope that people will recognize those symptoms early, get tested early. Testing is readily available, not just at our convenient care, but also at our physician offices as well. And so presenting with symptoms, getting tested, and then also getting treatment is very easy. And when we look at that, that has shifted a little bit over the course of the past few months as well. What the recommendations were on the monoclonal antibody have loosened up because of the availability. We still are administering that here locally and doing that routinely every day. And we're using the combination product now.
Yeah, and the combination product as it came out was really to combat as we were seeing additional strains of COVID that were being detected in Indiana, and so they started working on that. We've given 25 of the combination therapy. When you look back at the singular monoclonal antibody therapy, we had given well over 300, and that was very effective. The reason for the transition was the different strains and the way that can help the body to really boost the immune system and fight those additional strains. So it wasn't that one was ineffective and had to go to another one. It was just, as we see viruses change, medicine has to change to be able to combat that. But as you mentioned, the key element is if you have symptoms, testing is readily available. It's a antigen test, which is a rapid test, point of care, 15-20 minutes, and you know the results, and then are able to take action on talking to the provider. If you're of high risk for potential worsening symptoms, even hospitalization, then the antibody therapy is going to be a great option. Pretty seamless process as far as working with physician, get the order, come to our clinical decision unit. It's about an hour infusion and then about an hour observation. And we have seen tremendous results in keeping patients out of the hospital that the prior to antibody therapy data would suggest there was a pretty high rate that may end up in the hospital.
Yeah, and really, our highest risk group, the majority of them are vaccinated now.
Right.
So most of the people that we are seeing that are contracting the illness are in their 20s, 30s, 40s, and they're otherwise relatively healthy, but they tend to push off getting tested because they figure they've just got a little spring cold or they've got allergy symptoms. So it's important to recognize what's going on, get tested, and then get treated. The other big thing is trying to finish off things with vaccines. So when we look at the populations that initially got vaccinated, a very high percentage of them are vaccinated, the ones 80 and above, 70 and above, 60 and above. We still have a little bit of a population that's lagging in the 20s, 30s, 40s that we would encourage to go out and get vaccinated. And so we have some changes coming up with regards to the vaccine clinic, what vaccines are available, and then kind of a big vote coming up this week with regards to availability for the younger population.
Yeah, absolutely. So kind of stepping back a little bit, when we look at vaccine hesitancy and maybe medical care in general, when people are hesitant, a lot of times it goes back to affordability and access. I can very confidently say that in Knox County, those two factors are non-factors for the vaccine. We have same-day appointments, over 1,000 open appointments this week, which means you can get an appointment anytime. Convenience, we have day hours. We have our Wednesdays run into 7 p.m., so evening hours. So early morning, midday, late in the day, all of that is available to come into the clinic. And then through the federal government program, this is a free vaccination that is funded 100% through the federal government. We do collect some information, demographics, insurance information, but there is no bill that will go to the patient. So once the insurance works with the government on payments, then anything that's left over is written to the government. So there is no payment that goes to the patient, which is important. As we move forward, we have seen the age go from, starting at our oldest high-risk populations all the way down to now 16 and older being approved. Pfizer has submitted to the FDA, as we mentioned last week, that 12 to 15 group. And I did read over the weekend that ACIP, which is the Advisory Committee for Immunization Practice, will vote on Wednesday. They've done the review, but the final vote for that 12 to 15 population to be approved. And basically everybody expects that will be approved. And then moving forward, at Good Samaritan, that Wednesday that I mentioned being open until 7 p.m., so that 5 to 7 kind of after work hours, obviously that 12 to 15 needs a parent with them when they're getting their vaccination for consent, and also just in being there with the adolescent population. That'll be the ideal time for that group to come in and be able to get vaccinated, but they would be able to come in anytime.
And timing-wise, that works out well. Right now is kind of school sports physical season. So we know that kids are preparing for next year for school. Vaccinations are being administered. And that age range that you brought up, the kind of 12-year-old and plus range, is a typical vaccination time that we have for kids anyway. They generally get vaccinated around 4.5 years old, and then that picks up again somewhere around the 11 to 12-year-old range for a booster set of vaccinations. So this is really a good position in timing because they're going to be evaluated for vaccines anyway. We certainly have talked in the past, but one of the biggest reasons to get vaccinated in that age range is because it keeps you in school, it keeps you in sports. If you happen to have an exposure, somebody on the team, somebody in your class, and you've been vaccinated, you don't have to quarantine like you would have otherwise. And so it's a big appeal to a lot of people to realize that we all want to get back to normal. And as we go through the summer season and go into fall for school, people are going to want to continue playing sports and not miss out on school. And so we really want to help people get up to date on their vaccines for their general childhood and adolescent vaccines. But this is an opportune time to hit that as well.
Yeah, absolutely. And as you mentioned, that what's in it for me is not being quarantined. And there's two ways that if you're in close contact with somebody who tests positive for COVID, that you are not going to quarantine. One is being vaccinated, and two is having had COVID within the past 6 months. So obviously, if I got to pick which one of those two, I'm going to go with vaccinated rather than having to have went through the virus and recover and potentially have a pretty sick event and having the virus. So we're definitely advocating that the Pfizer product has been shown safe, effective in adults. Very similar results in that 12 to 15 whenever they have released the research and trial data. So side effect profiles have been about the same that we've seen with adults. Keep in mind that it is a shot, so there is some muscle pain at the injection site, and then just typical malaise, a little bit of tiredness, 24, 48 hours post-vaccination. But by and large, we have seen probably less side effects than even with typical vaccines, from what, and it's been scrutinized much more than any other vaccine.
Really, the only population that we've seen clinically that has a significant reaction after the first or second dose are really the ones who have had COVID in the past. So when I look at my patient population, the ones who had COVID maybe in the fall or over the winter months and then waited their time period afterwards, came in and got their vaccine, those are the ones that we tend to see have a much more vigorous immune response. And just like Adam said, not infrequently that is they have a little bit of low-grade fever, or they have some muscle aches associated with that. Sometimes they'll feel bad for 24 hours or so, but certainly nothing more significant than what you or I would experience with a tetanus vaccine or a previous flu vaccine. And there's a lot of a population out there now that is kind of in that situation where maybe they have waited because they had COVID in the past. Now's a good time to come in and get your vaccine. As Adam said, great availability right now, plenty of time slots available, plenty of the vaccine available, because what we will see is consolidation of that availability as far as where you can get it. We're probably going to see a distribution into physician offices, but as far as the clinic's concerned, that's changing too.
Yeah, and so at the end of this month, our mass vaccination clinic is actually going to close down as part of a transition period where we move over to the health department. So as that continues, vaccination at some point will be available in primary care offices just like any other vaccination. But for June and moving into the summer months, those that are getting vaccinated first shot this month of May, their second shot will be scheduled with Knox County Health Department at the health department location. So they're closing their mass vaccination site also, and we're consolidating everything into the health department. That's just simply a numbers game. When we look at how many are needing to be vaccinated in those months, there's no reason to continue to run really two operations. The Pfizer vaccine, Moderna vaccine will both be available. Johnson & Johnson probably to some degree, but right now we don't have any inventory of that product and don't really expect that right now. That's being utilized in some of the larger metropolitan areas in a different format and mobile types of clinics that are being ran through the State Department of Health. But the health department will have both Pfizer and Moderna, so they'll be able to continue to vaccinate that 12 to 15 population as we move forward.
And then as we talk, many people are asking globally what all is going on. And when we look at what has happened with the rise in India, also in Canada as well, people are tuned into what's happening in those populations. And certainly lots of resources are being pushed to those areas where it's highly needed. The concern people frequently have then, of course, is how's that going to affect everybody globally? I've had some friends and some family who have traveled internationally, and the U.S. is ultimately clamping down a bit more on testing to re-enter the United States. So people are concerned about that. Should they be concerned about that as far as their own travel is concerned?
Yeah, and I think that we're in a time period where you still have to be more cautious with travel than, let's say, pre-COVID. Sure. I mean, we know that post-COVID and during this pandemic, travel has probably forever changed. And looking at, is there an outbreak in the area that you're going to? What are the protocols for traveling? Different countries are having different rules. Over the course of time, that should become more standardized, that there's going to be some process for if there are cases, then testing. If there aren't, then probably not. But yes, more cautious with travel and what that looks like, where you're going, what the interactions are, and understanding, those, if you're going international, those countries and what their protocols are, both for entering the country and then for the United States and coming back. I think the one thing to keep in mind, though, as we look at India certainly having surges, Canada seeing pockets as well, we continue to push the vaccination program. And even in the newer strains that have been identified, the vaccine still has efficacy. Even if it is minimized to some degree, it's still very efficacious, more so than other vaccines that we have, such as the flu vaccine, which we've commented on before. So getting vaccinated certainly relieves some of that caution with travel. And we don't know where exactly that's going to go, but there is a lot of conversation going on about vaccination card being the next passport, and that being required to travel to countries. And whether that will or won't happen, still remains to be seen. But certainly we could see where that may become a possibility, because countries don't want to risk having the travel that leads to an outbreak. But at the same time, many countries thrive on tourism and having tourists coming in, and many of them are United States citizens that are traveling. So without coming up with a process to do that, it could be economically kind of disastrous for some of those countries. So those are things that are being talked about. Nothing put into place right now that I've seen from any country, but it certainly is on the horizon that those conversations will be had.
Absolutely. Any other big topics before we go to the phones?
Switching gears from COVID for a second, I would just mention that this week is National Hospital Week. Yep. So certainly in the community, if you see healthcare workers across the spectrum, thank them for what they're doing. Last year, when Hospital Week popped up and we were in the midst of the pandemic, I saw, the community just, rose to a whole new level in supporting healthcare workers. And not that that's been forgotten by any means, but we're kind of living in it now. Mm-hmm. So certainly remember your healthcare workers. Last week was Nurses Week, so we had a lot of activities here to recognize nurses. Same happening this week for Hospital Week. So a couple of good weeks to recognize the healthcare workers in the community that are doing everything they can to keep you safe and show up to work every day. And whether it's COVID related or all the other services we provide, our goal has been to offer all services and make sure that we're taking care of the entire community, from diabetic to heart failure to COVID.
Absolutely. So thanks. Tiffany, have some questions for us today?
No questions.
Wow. Pretty spectacular.
Yeah.
Well, thank you all very much for joining us. And again, we'll be with you in a week.